This brief mini lecture will walk us through the process of errors and omissions. Errors and omissions is a simulation of the checking process, which is the final check prior to a patient receiving a prescription medication. In the state of North Dakota, this process needs to be done by a pharmacist or a certified pharmacy technician. It's imperative that this final check includes all of the steps necessary to ensure that the prescription is legal and safe for the patient. Errors and omissions is a part of the North Dakota State Board of Pharmacy hands-on skill assessment. So prior to getting your license in the state of North Dakota, all pharmacy graduates come to campus, and the State Board of Pharmacy actually does a hands-on test. That test has multiple sections to it, including sterile compounding, non-sterile compounding, and case-based questions. One major part of the exam is errors and omissions. The State Board of Pharmacy sets up 20 to 25 prescriptions that have been filled with the prescription, the product, and the labeled medication. You, as the new graduate, proceed through each of those stations with a minute at each station to check the prescriptions for accuracy. You document any errors that you see, and then your performance is used to gauge your readiness to practice as a pharmacist in the state of North Dakota. So we will do practice errors and omissions this semester a couple of times, and then we will also focus heavily on it your P3 year in the fall. I'll lead that content, and that will really help you get prepared to practice and perform that during your board licensure exam, your P4 year. So this semester we'll do an activity in ExamSoft where you can just practice without a timer, and then we'll also do a couple of hands-on practices as well. But again, the North Dakota Board of Pharmacy requires that you do this in order to get your North Dakota pharmacist license. You'll do it hands-on with a minute to check each prescription. Here are some of the quotes that I've collected from students over time. I remember when I was a student thinking, gosh, this seems pretty silly. I'm just checking what someone else already did to make sure that it's accurate. But it's actually a really, really important process in continuous quality improvement and in patient safety. So here's a few quotes. EASNOs, which stands for errors and omissions, really helped me understand the process of a pharmacist's role in ensuring safe medications for a patient. The next student said, I really like that we got practice with this in lab. After I learned how to check, I could do that at my internship. The next student said, it was nice to practice since we will need to do this to get our license. I got more comfortable with it after I practiced. And finally, I was really worried I wouldn't do well, but it was actually way easier once I learned the steps. I felt like a real pharmacist. So today, during this little mini lecture, we'll walk you through the process of how to check a prescription for accuracy. That process will help you determine how you will move through and not miss any of the important information. And it will also help you understand the importance of that process as well. I've created a guide which can walk you through the process of checking prescriptions. You've checked prescriptions already with your peers through dispensing and consultation activities in Pioneer RX, but this is just a little bit different because you will actually be kind of documenting the error and doing it in a certain amount of time. That time won't come into play until your P3 year, but we do want you to get comfortable with checking prescriptions in a timely manner. And so this guide is posted to Blackboard. I'd highly suggest that you have it downloaded and then take notes on it as we're going through these lecture slides. This will be a really important guide for you as you refresh yourself on errors and omissions prior to any activities in lab where we do E's and O's, and also prior to your board practicum. So please remember to download this and also have it handy as we're working through the next few slides.
So you'll want to establish a process when checking prescriptions, and the first thing you're going to do is review the written or electronic prescription and ask yourself, are all legal requirements of a written or electronic prescription present? And the next question you'll ask is, are the prescribed medication, strength of medication, and directions for use appropriate? Secondly, you'll compare the prescription label to the written or electronic prescription. And you'll ask yourself, does the prescription label match exactly what was printed on the written or electronic prescription? Next, you'll compare the dispensed medication to the written or electronic prescription. And you'll ask yourself, does the medication dispensed match the medication prescribed? Then you'll check the NDC number of the medication. And you'll ask, does it match the NDC number on the prescription label? And the NDC number is the identifier for the medication, so if this is incorrect, then the medication is incorrect as well. Finally, you'll check the cap of the vial. And a child safety cap should be used unless noted on the prescription to dispense a non-safety cap, which is designated by NSC, or on the prescription label, it'll be designated as EZ for easy open caps. So now we have a couple of examples that we'll use to practice errors and omissions. So I'll give you about 30 seconds on this slide and 30 seconds on the next slide to check this prescription. Now we'll go to the next slide. Okay. And after checking this prescription, I found two errors. The first being the more obvious one, which is times was spelt wrong on the prescription. So that is an error that should be fixed. Secondly, this one may not have been as easy to catch, is that the quantity that was dispensed actually would not fill the entire prescription. You can see that the directions are to take 1 teaspoonful, which is 5 milliliters, twice daily, so 10 milliliters a day for 10 days. So that would mean you need 100 milliliters to fully fill the prescription. And this prescription was only written for 80 mils. And so if you would dispense this bottle to the patient would actually be short 2 days of medication. Look at what the doctor had written for. The doctor had written for Toprol XL, which is a different dosage form than the regular metoprolol. So there are 2 different forms of metoprolol, and it was just entered incorrectly to begin with. So this is an error that could cause a big difference in how the patient responds to the medication. Next. Okay, and what you can see here with this prescription, the error actually occurred when the data was entered to make the label. So the right drug was picked with the right NDC based on the label itself, but when you... Now we'll be going over some common errors that are found in pharmacy practice. The first being the prescriber's signature is missing. So if the prescriber's signature is missing or it isn't an electronic signature, then that is an error. The date the prescription was written is missing, or it's inaccurate when placed on the label. So I've seen this sometimes where a patient will bring in a script that was written a couple days ago, but it is entered as if it was written for the day of. Next error is a prescription is expired. So prescriptions for non-controlled medications are valid for 1 year from the date written, whereas prescriptions for controlled medications are valid for 6 months from the date written. So there is a difference in how long they are valid based on if they are controlled or not controlled. And a note here that's in red is that in lab and for the board, you shouldn't worry if the date on the prescription is, in quotes, old. So some dates that you'll notice in lab and when you're taking boards, they may be back in 2017, 2018, and do not worry as long as they match the prescription and the label, then it should make sense. And then the last error is the strength of the medication or the directions for use are missing or are inappropriate. Another error is the incorrect quantity of medication is prescribed. So this is common with antibiotics. A doctor will write to take 1 tablet twice daily for 7 days, let's say. But then they'll write for a quantity of 10. And this is misleading because based on the directions, there should be a quantity of 14. So that is an error that needs to be verified with the doctor. Next, the patient's address is missing from the written or electronic prescription. So verify that an address is present. Another is prescription for a controlled medication is missing the prescriber's DEA number. This is required by law that a DEA number is present. A prescription for a controlled medication authorizes as needed or PRN refills. So the most refills that are allowed for a controlled medication is 5. And for a C2 medication, the next bullet point, a C2 medication cannot have refills. So it's a one-time only prescription. And the last error on the slide is medication prescribed is spelled incorrectly. So this is another error. The next error is the information on the prescription label does not match the information on the written or electronic prescription. So when comparing these two to each other, a number of things can be incorrect, including the number of refills, the prescriber, the patient name, the quantity of medication, and the medication or strength of medication. The next error is the directions for use do not match those on the written prescription. And an example of this is that the directions for use must specify a medication dosage form. So if the medication dispensed is a tablet, you must ensure that the directions for use specify a tablet. And it is considered an error if the directions for use would say capsule instead of a tablet, so verifying that the dosage form is correct. Another question to ask is, are the directions for use spelled correctly? Another thing that we should note is that the medication route of administration, that is not required by law on a written or electronic prescription, but it usually is included. And if it is included, it must also be documented on the prescription label. So for example, if the directions for use on the prescription specify PO as the route of administration, then the prescription label must include by mouth in the directions for use. Lastly, the date dispensed or the prescription expiration date on the prescription label does not match the date written on the prescription. And as we had mentioned earlier, if the medication is a controlled substance, the expiration date on the prescription label must be 6 months from the date the prescription was written. The last error to check prior to dispensing a prescription is to ensure that the correct cap is used, so either a child safety cap or an easy open cap. So if NSC is written on the prescription by the prescriber, a non-safety cap must be dispensed on that vial. And if NSC or EZ for easy open is printed on the prescription label, an easy open or a non-safety cap, either or, same type of cap, that cap must be dispensed on the vial. And a special note is that it is required by law that nitroglycerin, and nitroglycerin is a medication that is prescribed for chest pain and a possible heart attack. This medication must be dispensed with a non-safety cap so a patient can easily open the vial. And another note is that it is not required by law that topical preparations are dispensed with a child safety cap.